Hello, this video is going to cover the neuro, muscular, and the abdominal assessment of the adult patient. Introduce myself to the patient. Hello, my name is Shanice. Can you tell me your name?
Judith Johnson.
Can you tell me your birthday?
September 7th, 2005.
Do you know what day it is?
Sunday.
And where are we right now?
Home.
Perfect. So patient is oriented to person, place, and time, as well as location. And looking at the patient, on introduction, I am taking in his visual appearance, his mood, his affect, the symmetry of his facial features. I'm also keeping it in mind, inspecting his posture, skin tone, and any other general appearances. When first looking at the patient and doing the neuro, I am going to check for the cranial nerves to ensure that they're intact. First being cranial nerve 1, which is the sense of smell. Can you close your eyes for me? And breathe in. And what does that smell like?
Nutmeg.
Perfect. It is indeed nutmeg. And in continuing with the cranial nerves, I am also going to check for cranial nerve 2, which is the visual acuity. Having the patient cover either eye. Sir, you can wear your glasses for this part of the test. Cover either eye. And I'm going to have you read from left to right the smallest line that you possibly can.
L, T, F, P, H.
And that is 20/20 vision in his right eye, in his left eye. And if you change the other eye, read that whichever line you can, going from right to left this time.
H, P, F, C, L.
Perfect. That is 20/20 vision in both eyes. The patient does wear glasses, so I did have him to keep those glasses on. While he still has the eye covering, I'm going to check his peripheral vision. If you can close your one eye, I'm going to put up a set of fingers on each visual plane and just have you identify how many fingers I have raised.
1, 2, 3, 4.
Perfect. Cover the other eye. And again.
1, 2, 2, 4.
Perfect. So his peripheral vision is intact. I am going to check the patient's extraocular movements at this time. That is checking to make sure that his pupils are equal reactive and that they dilate and constrict appropriately. Having the patient look directly over my shoulder. Alright, just moving some down the way. I'm going to have look over my shoulder. And I'm just going to shine the pen light into the eye, making sure that the pupil constricts, and doing it again on the same side, making sure that the opposite pupil constricts, and doing the same test on the opposite side, making sure that that pupil constricts when light is present, and the opposite eye constricts as well, equally on both sides. And in testing for convergence, I'm going to have the patient focus on my pen light, not move his head, and the eyes do converge as the pen light goes closer. I'm going to check, having the patient continue to look forward, not move his head, follow the pen light, Still checking for that extraocular movement of the eyes. Okay. That is the vision part of the cranial nerves. Doing orally, I'm going to have the patient open his mouth, stick out your tongue, move it from left to right. Perfect. Touch your tongue to the roof of your mouth. And then that is cranial nerve 12. And I'm going to check his gag reflex, which is cranial nerve 9. Open wide, say ah. And gag reflex is indeed intact. In checking for neural assessment, I'm going to make sure that he has sensation appropriately throughout his body. Taking a piece of cotton, I'm going to have the patient close his eyes. And I just want him to identify if he can feel the sensation.
I can feel it. I can feel it. I can feel it.
Which he is able to sense the feeling of the cotton appropriately across his face. That was cranial nerve 5. I am going to continue my assessment and inspecting the patient, going down the upper extremities. Again, I am checking to make sure that his chest is symmetrical. Can you sit up straight for me? I'm going to have you shrug your shoulders down. Resist my hand push. Perfect. Opposite side. Perfect. I am also palpating trapezius, clavicles, along the chest, making sure it's symmetrical. The rotator cuff. Along the elbow. Again, making sure that there are no open lesions. Checking the hand to make sure that there are no cysts. Patient does have calluses, which is normal. I can check the radial pulse as well as the brachial pulse. Both are intact. And doing the same assessment on the opposite side. Checking for any lesions. Hair distribution under his armpits. No abscesses, no cysts, no bumps. And again, going down, I'm checking his nail beds, making sure that he has good capillary return. Checking the knuckles in between the fingers. Again, checking that radial and brachial pulses are intact. And checking the patient, I am also going to check for his reflexes as well as his range of motion. And checking his reflexes, I am going to have him loosen his arm as much as possible, nice and loose, and strike my hand, which his reflex is intact. And again, nice and loose. Perfect. And the opposite side. Loosen up. Thank you. Loosen. Perfect. Another way to test would be to have the patient loosen, nice and loose, arms dangling. And I can also strike at the elbow and should have reflexes, should cause him to strike out. And check it for his range of motion. I'm going to have him follow my directions, arms outwards. Up. Close your eyes and hold your arms up as long as possible. And that's the pronator test, making sure that they are nice and even. Romberg sign. Okay, perfect. And while he also is here, I'm going to have him go adduction, abduction, over. I'm going to have you push against my hand as hard as you can, and the other way. Elbow up. And you're gonna push against me. I'm gonna pull, you're gonna resist. Perfect. And push. And the opposite side as well. Pull, 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 pull. And push. Perfect. Arms out. Over your head. And if you can go down between your neck. Perfect. Arms out again. Up. And going from the bottom underneath. Again, that is external, internal, abduction, and abduction and adduction. You can bring your arms back to the front. Perfect. And inspecting the patient. I'm also looking at the scapula. Down spine. On both sides. I'm checking for any tenderness, any masses that are not apparent. Okay. I am going to check the patient's sense of sensations. Close your eyes. Well, first, while you're with your eyes open, I'm going to show you a few different feels. That's dull, sharp, and soft. Okay. Close your eyes. I'm going to check on both sides and have him let me know what it is.
Dull. Dull. Sharp. Sharp. Soft. Soft.
Perfect.
Dull. Sharp. Soft. Soft. Dull.
Patient senses are intact. Pause. Having the patient lie on his back, I am going to check his abdomen, and just because of the space constraints, I will do the seated portion of this assessment in a bit. Again, I have noted the patient's symmetrical alignment. Again, skin is intact, no bruises, no lesions, no birthmarks, no scarring. He does have hair around his abdomen and across his chest, which is normal. And checking for his abdomen. After inspection, I am going to auscultate because I don't want to palpate and disturb his the abdominal sounds, bowel sounds. Lightly placing the diaphragm on the abdomen. In all 4 quadrants. I'm just checking for normal bowel sounds. And he does have normal active bowel sounds in all 4 quadrants. While I am auscultating, I can also go midline and auscultate his aorta, as well as his iliac arteries, and his femoral arteries on both sides. After auscultation, I'm going to do palpation, first light, checking for any guarding, checking for any masses, looking for any signs of pain or discomfort, which because I don't see any, I'm going to do a deeper palpation in which I am checking for his abdominal organs. If I go mid-clavicular, I'm able to feel his liver, what's the spleen, and if I can percuss. Tympanic at the top in the upper quadrant. And a bit more dull towards the lower quadrant. And that was inspection, auscultation, and percussion. I was able to feel the borders of the liver. I'm going over, as well as the spleen. The kidneys are more posterior, which I am not able to palpate his kidney. Can you turn just a little bit? Just a little bit, that's good. And I am checking cranial nerve 8. Going to ask the patient if he can feel the sensation, vibration equally on both sides. And then doing the Rene, that was the Weber test. Doing the Rene test, I'm going to strike the mallet, placing it on the mastoid bone, and have him somewhere he can no longer feel it.
I can't feel it.
And check in air conduction, and have him let me know when he no longer hears it.
I know.
Okay. And doing it on the opposite side as well, against the mastoid bone. When he no longer feels it, he can let me know.
I know.
And again, air conduction when he no longer hears it.
I don't know over here.
Perfect. and deep palpation. Pause. Continuing with the assessment of the patient, I'm going to look down his legs now, making sure that skin is intact, equal hair distribution, no open lesions. Bend your knee, bend your knee, relax your leg. Check it for his, you have to bend, you have to relax. Check it for the patellar pulse on both sides. Checking. I'm also going to check for the posterior tibial pulse. Yes. Thoracic rectal pulse, again on both sides. Which are intact. Checking the patient's foot, checking his toes. I'm going to have him raise his legs, checking his range of motion, lower. I'm going to have you run your heel of one foot along your shin of the other, and do the opposite side. Heel to shin is intact. I'm going to have the patient raise his foot, close his eyes, and tell me when he can feel sensation. Which he does. Okay, perfect. All right. While the patient is still seated, I'm going to have him close his eyes, and I'm going to check his ability to identify certain objects. Close your eyes, please. Close your hand. Can you tell me what that is? Perfect. Open your other hand, please. Close. Can you identify what that is? Open your hand. Keep your eyes closed. I want you to tell me. God bless you.
Okay.
Keep your hands open. And just tell me what I'm writing on the side of your hand.
Okay.
And on the opposite hand, doing another
S.
and S. Perfect. And then having the patient stand up. Take a step forward. Checking down his spine. I'm going to have you bend forward, touch your toes. Checking the curvature of his spine. Stand up. Keep your eyes closed. I am going to have you put both hands up, raise them. And we're just making sure that we check his ability to stand and not fall over, which he is able to do. Put arms down, close your eyes. I'm going to check his range of motion at this point. Can you follow my instruction? I'm sorry, turn around this way. And just follow what I do. Take a step back so the camera can see you. And follow what I do to the side and up. The opposite side and up. And I'm going to have you go lean backwards, extension of the spine, and up. I'm going to have you raise your leg out to the side, adduction, adduction, and if you can hop, again, please. Thank you. And if you can stand at that wall and walk from on your heel to your toe to the opposite wall. Perfect. And that completes my assessment.